gradually ease these restrictions. The first phase will look something like this when we've hit the benchmarks that Dr. Cohen described earlier. The stay-at-home order in phase 1 will remain in place, but it will be modified to allow more reasons to leave home, including commercial activities at any business allowed to be open, such as clothing stores, sporting goods stores, bookstores, and other kinds of retailers. That will open more opportunities to go out safely without the restriction of only going out for needed supplies. Now remember, those retailers and services will still need to implement social distancing for their employees and their customers, plus enhanced hygiene and cleaning, and to screen their employees for symptoms. And in phase 1, mass gatherings are still going to be limited to 10 people or fewer. But our parks can reopen in phase 1 so long as they follow the mass gathering limitation, and our outdoor exercise will continue to be encouraged. Face coverings will still be recommended in public when social distancing isn't possible. And in this phase and other phases, the same restrictions will remain in place for nursing homes and other congregate living settings, because we know that that's different. It's a confined community. This virus is going to still be with us, so we have to be extra careful. So after a minimum of 2 to 3 weeks has passed and we continue to hit our marks and benchmarks, we can enter phase 2. Here, the stay-at-home order can be lifted, but we will still encourage the vulnerable populations, those people who are most at risk of becoming seriously ill. We'll encourage them to continue to stay at home. Our houses of worship, restaurants, bars, and other businesses can open their doors for people as long as they operate at reduced capacity. The number of people allowed at a mass gathering will be increased. So then, after a minimum of 4 to 6 weeks has passed, and we continue to hit our marks and our benchmarks, we can enter into phase 3. In this phase, the guidance for vulnerable populations, those at risk, they will continue to loosen. There'll be increased capacity for bars, restaurants, and other businesses, entertainment venues, and houses of worship. The mass gathering ban will increase to allow more people. In all of these phases, as I said earlier, strict rules will continue to apply to nursing homes and our congregate living facilities. It's important to know that as we move through these phases, if our infection spike or our benchmark trends start to move in the wrong direction, we may have to move back to a previous phase in order to protect public health. As we're doing now, we will continue to use the best science and data available to make those decisions and continue our consultation with business and industry leaders. I know the people in our state are eager to move forward, and we will get there. But right now, I appreciate everyone who is taking this seriously and staying at home to protect themselves and others. Now, we know we won't go back to the way we lived in January or February of this year anytime soon. We need a vaccine, and we need more ways, such as antibody tests, to determine our level of immunity. But if we keep protecting ourselves and go back to work and play carefully, we can rebuild the damage that this virus has done to our state. North Carolinians are tough. We've been through trying times. And I know that we will tap that resiliency to look out for each other, encourage each other, and support each other as we beat this virus, and we will beat this virus.